Hey, good morning, and welcome to Healthy Indoors Live. We're actually streaming live from Nashville, Tennessee at the AIHCE 2022 Convention and Expo. Joining me today is my co-host of the Indoor Environment Show.
Yes, first time in person
I well, not first time in person ever.
on the show.
I mean, first time in person on the show. Yeah, we've never in all the times that we've done the Healthy Indoors live show, we've always been in our studio in Syracuse. Don's always been in Ottawa most of the time,
Mhm.
and so here we are. Here we are together, which is
And we have a distinguished guest too.
we
Thank
do
you.
have it. And I'll let you introduce our distinguished guest, so I don't feel bad about
Anything.
anything. So the challenge here is whether or not we can actually live stream from an event floor with a Wi-Fi hub.
There you go. We'll try.
We're
our
finding
best.
out though. It seems to be working. So
Yeah, there you go.
all right.
So Alex Laveau is the owner and principal toxicologist and certified industrial hygienist for Exposure Assessment Consulting LLC, located in Orlando, Florida. He's the current chair of the AIHA Indoor Environmental Quality Committee. Over his 13-year career, he has evaluated environmental and occupational exposures and has performed toxicological evaluations of chemicals and biological agents. He has also performed human health risk assessments of contaminated sites using US EPA and state regulatory guidelines, and has monitored remediation activities at these sites. In order to evaluate the exposure impacts on building occupants, he has performed indoor environmental quality assessments, including Legionella and water quality assessments at healthcare, residential, and industrial facilities. So welcome, Alex.
Thank you. I appreciate you having me.
Well, we're very glad that you were able to come.
Sure.
So let's talk a little bit about the IEQ committee first. What are your goals for as the chair of the IEQ committee?
Well, as an oncoming chair, and I took over a few months ago on the committee, I think our overall goal is to come back to being a cohesive committee. In the beginning of the pandemic, we got engaged early on for coming up with guidance documents to help industry in non-healthcare settings to aid in what people should do, how they should approach COVID-19. And we worked on a lot. Don, you even worked on some documents with me. As time has gone on over the past 2 years, there has been, a shift in focus. I think we got a lot out early on, and lately we want to become more of a cohesive committee again. We want to work on getting our members back and being integrated, interactive, and that's the hope at our meeting here this year. That we come together and talk and see how we can work forward together as this coming year as a new committee. I think we want to also increase participation in the committee. There's been a lot of, I'll say, attrition. A lot of people have decided, they've got other priorities and other interests and other activities and other committees. But we want to make sure we not only retain the people that we currently have, but we get new people, new members. Recently, Future Leader Institute, FLI, was in Tampa this year in March, and I went over there and gave a talk, 5-10 minute talk, and said, listen, this is the importance of volunteering. It's always great to contribute your knowledge, skills, and ability to coming back and giving back to the membership and people that are in the community on what you can do. And I said, also, we'd love to have you on the IEQ committee. So we did some outreach to get people to be more interactive with us and maybe come over to our committee and show them what we have to offer them that they may not be getting now on I'll just say, local level.
So when is the IEQ committee meeting this week?
It's tomorrow night, Tuesday evening at 6:30, and in the at the Omni.
Great. Okay. So one of the things I was interested in is wondering about your background, and we talked a little bit about the work you were doing, and how does that affect what you do as the chair of the IEQ committee?
I have done a lot of indoor environmental quality assessments during my career. It's engaged both chemical and biological exposures. So I had the opportunity to evaluate a number of different exposure scenarios. I've done a lot of even residential exposures. I've done occupational evaluations. And like I said, Legionella is a big one. I've done a lot of Legionella work. That's been a lot of healthcare facilities or industrial facilities. And that kind of gives me the idea of what people should know and what maybe they don't know. So that kind of says, these are the, I'll say, data gaps and knowledge that people currently have and where we need to target strategically target how we interact and how we bring these people and bring them knowledge that they don't currently have. Because a lot of times it seems across the board that they just don't have. A lot of people don't have the knowledge that they probably should have for a variety of reasons. So I think one of the important things, and going back to the goals and discussing it, is collaboration and outreach with other organizations so we can get those people on board. A lot of the work I've also done is from a toxicological standpoint. That gives me a unique perspective on exposures, because not only does it deal with the exposures, it deals with the potential dose someone may have from those exposures, and gives a unique way to look at additional, I'll say, control mechanisms in the indoor environment for not only reducing exposures, but reducing the potential to absorb a dose from those exposures.
I mean, one of the questions I would ask you is, so as the committee and representing AIHA, your goals are to deal with professional practitioners, professionals in the industry, right? For
Correct.
the most part. Is there any thought for outreach to just a general public, general community? I know you've put AIHA has traditionally put out documents that sometimes do reach into the consumer realm. And it's, especially coming off a pandemic, we're coming off a global pandemic where there's, guidance is really kind of important.
Sure. No, I think some of the guidance documents that we even worked on for COVID were more for the general community. So one of the ones that I think Don and I, pardon me, had worked on was just a cleaning methodology for the in general employee. It was very, it was presented in a way for them to understand these are the things you should and should not do from a very, I'll say, basic level. So it not for the practitioner, it's targeting in part the practitioner, but that information is definitely for the general population. I also think that part of, in talking with AIHA, what we would like to do is integrate ourselves more into the community, not only from a professional standpoint, but an IEQ standpoint, and saying, outreach. And we'll probably talk about this later, getting out to those organizations that need our professional services, so we can be that face out there in community, whether it's at the school board level or at the school level, or understanding any other indoor environmental quality issues that buildings have that we may need to directly speak with stakeholders to say, listen, this is what we do as professionals, and this is where our knowledge may help you on a basic level.
So since the pandemic began in March of 2020, I should say, I know you have worked on a number of AIHA documents and webinars concerning COVID-19. Can you please tell us about those webinars and some of the documents as well? And do you think that they're still relevant?
Sure. Early on, like I said before, we were engaged by AIHA to work on some guidance documents for non-healthcare industries, the importance of, how to deal with potentially cleaning this material or cleaning surfaces. And that kind of went beyond, the safety of disinfectants. We moved on to engineering controls once the knowledge kind of expanded. I also worked in some webinars. AIHA had reached out to me and said, would you like to, or would you be able to participate in these webinars? So I think I did. I did a number of them. Again, in the beginning, kind of summarizing what the virus was, because we were still in those early stages, and different ways, engineering and administrative controls, breaking down the hierarchy of control for the individuals to say, listen, on a local level, these are the small things that you can do that will add up to larger control mechanisms. Later on, I was engaged by AIHA when it came to the importance of occupational health and safety professionals in the school setting. So we gave some webinars on schools, and there was a town hall on schools where we had other individuals that were actually, they were, one was a principal out in the school area, a number of different individuals that had firsthand knowledge that we're experiencing every day, for us to bounce discussions off and ideas off. And discuss how they handled it versus how we as professionals recommended handling it. I think a lot of areas meshed over on how things were integrated on the local level versus what we were doing on a national level. And I think those are very topical still. And I think there are still issues that we probably should address, and there are discussions that we have in those webinars that we should take to the next step. And that's kind of one of the goals I have for the IEQ community, is taking that, as I said, beyond the webinars, getting out there into the field. I reference those. I send those webinars out and say, listen, if you're interested, anybody who's interested, look at these webinars. If you have questions, let me know. I'm happy to answer them for you, because the whole goal is not only to answer some questions, but lead to other questions that may help individuals.
Now, are these webinars publicly available, or are they just for AIHA members? Or
they are publicly available. I know some are on the AIHA website. Some are, I think most are on the AIHA website, or there are links to them that are hosted on other websites for people to access easily.
And that's something we'll try to get that available up here on our site too. So we'll get
Yeah,
those links
there is
posted later on.
There is a COVID-19 page on the website, which gets you to a lot of the webinars and also the documents that are out there. And I was wondering if you would maybe take us a little bit through some of the documents that I know have been published by our colleagues in most cases. The first one I would talk about is the role of industrial hygienists in a pandemic. I was very pleased to see that was one of the things that was emphasized by the president of AIHA in his opening remarks at the opening session today.
Sure. That document was first, I believe it was first introduced, the first iteration was in 2006, and it was recently updated last year in 2021. It incorporated a lot of good information, a lot of good lessons learned that we had during the pandemic. And it told us, these are the things that we were missing or potentially missing and not taking care of in the first version to give us a better scope, better understanding. So, a lot of that information, I think we identified early on, again, in those guidance documents that we had worked on, that was likely, I want to say integrated, but just a check mark to say, oh yeah, this is areas that we need to focus on that we may not have in the first one. It's in the role of the IH in the pandemic is good, I think, cohesive, one easily referenced document and say, listen, this is where you can go to get all this information. And it has a lot of good resources and references that information too on where to go find it and what may augment what's already in that good document.
Right.
Well, and that information, clearly evolved from 2020. We started in March of 2020, kind of in a hole, to say the least. And I think everybody was looking to the cognizant authorities, to bring some credible guidance, and we had a lot of noise. Getting through the din and actually getting good info out. Seems like it would be tricky.
Not only getting good info out, but making sure that people realize and recognize that it was good information, because like you said, there is a lot of noise out there and there is a lot of postulating, but we use our knowledge of previous issues, previous SARS and any other outbreaks that may have occurred, small localized outbreaks of issues, and how those were handled. And we grew in our knowledge on that, said, listen, early on, there are other issues here that people are not addressing that we need to get ahead of. That's why, again, midsummer, I don't even say midsummer, the summer of 2020, we said, we need to get an engineering control ventilation document out there because we realized this is an issue. And that's why we worked hard to get that out. I think we got the first version of that out in August. I actually worked on the an article for AIHA that that was asked to do that I published. I think it was Environmental Health, one of the publications for, listen, this is what we're doing. This is what we are getting ready to publish. Keep an eye out for it because it's coming out soon. And getting that information out to people and making them understand, a lot of it was a sell. We a lot of the questions were, well, why are we going to believe you? Right. Who are you? You do industrial hygiene. We don't even know what industrial hygiene is.
Well, general public, right?
General public.
That's a question that you've had just with the rebranding of AIHA too.
No, I completely
that goes to
agree.
a deeper topic.
No, yeah, getting them to understand who we were, why we knew what we were talking about. Infection prevention and control professionals know who we are.
Right.
We can collaborate and talk with them and they have no problem, in the hospital setting, but outside of that setting, a lot of them are like, a lot of people are like, how can you contribute to me? So it was selling them on who we were and then making sure that they knew the document and guidance that we had was reliable and relevant for the scenario that they were presented with.
So some of the documents that came out were also mentioned in the opening session today, and that is the Back to Work Safely program, which covered 27 different industries. Perhaps you could give us a little bit of information about that as well.
Sure. That document, I had reviewed some of those documents, but that overall was a collaborative effort by a number of different individuals, some on the IEQ committee, some across other committees, working collaboratively to produce these documents on as the title states, getting back to work safely. It was broken down. I think when they were initially published, there may have been 10 documents that were out there, and I can't remember the numbers expanded to. Last time I saw it was 27. I think there may be a few more. But the document's intended purpose was, listen, this is your particular setting, whether it be a child care facility, or I'll even say, an amenity hotel kind of setting. Say this is what you need to target for your specific scenario that you're dealing with and how to address it.
Right.
And those documents, I think, were great documents. And I think people actually relied on those. And I know we had some other interactions by people that were larger in the community. I think Mark Cuban even had talked about the Back to Work Safely and referenced them at one point. I think that got a lot of traction for us from Industrial Hygienes and AIHA for getting that information out there. I think it was a great effort for getting that out there. And I think even I was talking with Larry Sloan, CEO of AIHA, and I think recently within the last 6 months or a year, there was a revision to them to incorporate any additional information, but streamline it and include any other sectors that may not have been initially captured in those. And said, listen, these are also applicable to other areas as well, making sure that people were using the guidance documents and now the knowledge that they were there. I think they were great.
Well, yeah, they've gotten over 4 million downloads.
Oh,
So,
that's great.
yeah. So I mean that it shows that people are very interested in going to the Cognizant Authority to get the information they need for their specific problems, like you mentioned, daycare centers, public schools, office buildings, all the variety of different ways in which people potentially could have been exposed to the virus. So,
Right.
So bringing that up to the current time, what projects are the IAQ committee working on currently?
Well, I'll say currently, from my perspective, currently the main project that I'm working on is getting active membership and getting new membership.
Yeah.
Getting that is going to drive our force going forward.
Okay.
We have discussed some collaborative efforts in IICRC and ACGIH Bioaerosol Committee, some other committees. What I'd ultimately like to do is integrate ourselves, as I was saying earlier, more so in the community. They're based on COVID over the past 2 years. There's been a lot of rules, regulations, and guidance issued by not only federal authorities, but state and local authorities. I'd like to see industrial hygienists targeting those areas and getting integrated in them and people understanding where they are. Some of those rules they mention industrial hygienists. Some of them don't mention us at all. Mark Ames with AIHA is very on top of identifying what issues are currently pending out there for.
You mentioned Mark Ames. You might refer to what is his title?
He is the what is he?
He's director of political action.
Thank you. I couldn't remember his official title, so
Right.
Thank you. So yes, he's very upfront, and he's down in the weeds on what's going on for political action and laws and rules and regulations that are currently pending in not only at the federal level but in some state and local levels as well. So I'd like to see us getting involved in the community at those levels. Figuring out how we as industrial hygienists, I mean, there's not a lot of, I think the last roster count I saw there may be approximately 115 people on the IEQ committee. I'd like to get us out there doing something to get that outreach, get us know. I've reached out to people in my community. I mean, I'm in Orlando, Florida. I start small and see where I can get. I've reached out to people in our community. We have in my community, we have a local newspaper. I wrote an article for that, and I think the end of 2020 and said, listen, this is the options, or these are things that are available. Doing stuff like that, writing an article for your local newspaper or whatever it may be, just to let them know who we are and how we can help them. And with those laws and rules and regulations, not only do we want to integrate ourselves, we want to make sure, as you said, there's a lot of noise. We want to make sure that we're getting ahead of any noise that may be there to get them the best sound science for making decisions based on these laws.
So I put one of the things I'd be interested in is, and maybe you can discuss it briefly, is what are some of the subcommittees that are in the IEQ committee, and what are they working on?
One of the subcommittees is, I'll say unofficially, but officially, is the integration with IICRC. We're working on some things with some of the mold guidance that they have going. We've provided comments to that. We've also, they have some documents they're working on for the results or evaluation of the fire impacts on buildings or facilities, whether it's residential, whatever. They're working on that as well. Right now, again, the collaborative efforts is what we're working towards. I know we have some of those small groups that we're working on. We've gotten some stuff done. We've gotten some mold guidance that's been out there. I know you've worked on some stuff as well. But overall, as far as I'll say a good effort moving forward, we want to get back to that cohesiveness of the committee so we could have those good directions.
Great. So now, obviously, there's a number of people involved with IEQ who are going to be doing presentations at the Nashville AIHCE. So could you give us a little bit about what the focus of some of those presentations are?
Sure. You know, I was actually looking yesterday at those, and if you go to the page specifically looking targeting talks, if you look it up, there are about if I was looking, there are probably I'll say 20 or so talks that are labeled IEQ or indoor environmental quality.
Mm-hmm.
Based on what we know from what we're working over the past 2 years for the pandemic, it's funny because I saw titles of a bunch of other talks that were IEQ related, but they weren't tagged as IEQ. So I think, you know, a lot of the talks are dealing with aerosols that are tagged IEQ, dealing with COVID, dealing with Legionella issues. Those are the big ones that I think have multiple talks on them. But, you know, IEQ has got branches everywhere, whether it's the risk, evaluating the risk from exposure to COVID, or it's ventilation controls. We've got the IEQ everywhere in a lot of different talks that just isn't specifically targeting it, but is included in those as part of what they're actually talking about. So, you know, and that's, I think, important for us to, you know, come back and make sure that we as a committee are making sure that those talks are identified potentially as IEQ, and talk with the authors or the people presenting and saying, listen, it seems like you have an IEQ component. Would that be something you would identify in your talk? Because a lot of them dealing with COVID, dealing with aerosols, dealing with ventilation, all kind of stems from the indoor environment.
So what's interesting too is, you know, that there's two basic acronyms that are out in the industry. Obviously, IAQ preceded IEQ. You know,
yes,
and IAQ is obviously a much more focused, just talking indoor air quality. And I think we in the industry, I think at times we're jaded in that we actually believe that everybody understands what these acronyms are. I mean, I found myself in social gatherings outside of the industry, you know, with family, friends, and wife's friends especially, and start, you know, rattling off, you know, the jargon with the acronyms, and they don't know what you're speaking about, you know, and it's right down to basics. I mean, again, if we're going to the general community, how do we distill this in such a way that it's discernible to, you know, somebody in the general public?
No, I agree. You know, and I'll you know, I like using this as an interaction that I've had before. I went to a social mixer locally, again, trying to, you know, get in touch with the community and find out how we can get involved. And there are a number of different realtors there. And I spoke with the realtors. I said, this is what I do, indoor environmental quality. And what it came down to, the only way they understood what I did was I said mold. And they said, I understand.
Yeah,
that was the only way that I could connect with them on a level that they understood.
You bring out the M word. I mean, that's the scary word. It has been since the mold rush in 2000. Right?
I know, but it's I try to explain there's more than just that.
Right.
But you know, it's you know, like you said, there's acronyms and explaining it, because there's so many different layers built onto it, just beyond the M word, as you said.
Now, I believe the committee was involved with a recent publication with regard to Legionella. It's an update, I believe, if anything. Do you have a few words to say about that?
Sure, yeah. So I think the initial Legionella guidance document that AIHA had published was in 2016, I believe, 15 or 16. And they just recently published the second version of that. I had the opportunity to do a peer review on it. It's a great document. It builds a lot on what was already previously known, presented, and expands upon it. I don't remember how many pages they added. I mean, I think it's almost double the size of the original. It's a great document for targeting Legionella. You know, one of the things we had discussed, and I discussed with a lot of people after building closures or facility closures from COVID-19, was the importance of performing these evaluations on your facility to make sure they were not impacted with Legionella. And this, there was a lot of people that were very receptive of that information, and a lot of people that were thought it was noise. But I think that, you know, I think there was a lot of understanding as time went on that yes, this is an issue. This guidance document is great, and I think it even discusses, you know, these are things you need to look out for when you have stagnant water in your facility from a building closure, and it kind of lays all that out, because again, it was great lessons learned from the pandemic, and saying, listen, these are things you need to pay attention to that you weren't before. So no, it's a great document, and from what I understand, it's available now for a purchase at AIHA at the conference.
Oh yeah, no, definitely is here, and it's a good document as you mentioned, and it's relatively inexpensive to buy, but it's certainly a good one to add to anybody's library.
Oh, definitely. I
Yeah.
definitely recommend that as having one of your resources.
So, what other activities is the IQ committee planning to conduct in the near future?
Again, we had kind of discussed it already, getting integrated within that community for any regulations or rules that are out there. I'd like to see a lot more collaborative efforts with other organizations. And speaking with Larry Sloan, I know he's reaching out to different organizations on how we may be able to collaborate. We had previously, I think one of the previous presentations that I gave on schools was with the infection prevention control folks. I'd like to be able to get more integrated with them, and do more with ACGIH if we could, and find out how we on the different IEQ committee can expand and use our knowledge and understanding and skills to contribute to those other committees and get involved and get those people maybe involved in our committee. So there's a lot of cross collaboration on how we can get our knowledge and understanding out there and how we can better even get our guidance documents out there. Because we're all part of different organizations, but we're all after the same goal.
Absolutely.
And, a lot of people in other organizations were putting out guidance documents that were very similar to ours at different times. It'd be great if we could, and then this finally did occur on some of the guidance documents, but it'd be great if we could continue collaboration of work together and have a lot of people's names on those guidance documents and move forward. So we can say, listen, we all worked on this. We all know the goal. Let's get it done.
I mean, that is a challenge, though. It's sort of like herding cats to some extent, right? I mean, because because there is, traditionally in this industry, it's very turfy. I mean, to be honest, it is. And different organizations have sliced up different components, and obviously you've had the opportunity to work with other groups like IACRC and some collaborative information. How do we push that forward? Because I think we're at a point in time, here in 2022, coming off, or at least starting to come off of this global pandemic. Everybody is keenly focused on the indoor environments globally, more than ever in our lifetime.
I agree.
So, this is a great opportunity to move things forward, I would say. So how do we do that?
That's
right. Yeah.
So you want me to dance around this political issue? That's fine. No,
well, as best you can.
I think that we, again, speaking with Larry Sloan, I think that he's working on efforts to, I'll say, take down some walls so we can more easily have collaborations. Maybe have a memorandum of understanding with some individuals or folks and say, listen, this is what our goal is. I know we all have we all have our own little things that we do. Our own little. I want to say pet projects, but things that we focus on. But to let us, because what we have to understand is people that are on the AIHA IEQ committee are also on other committees. Like Don and I are member candidates for the bioaerosol committee.
That's correct.
We are on those other committees doing work on those committees. So we know what's going on at both. It's important to understand, listen, we can serve as a bridge between the two if we're allowed to, and say, listen, how can we work collaboratively, or, hey, ACGIH is working on this. How can we work with them, or on the vice versa? AIHA is working on this. Can we work with them in a collaborative effort? And just making sure that the barriers to collaboration are, I want to say, taken down completely, but a little lowered, so there can be some cross pollination there.
Sure, it makes total sense. Honestly, there's different core expertise coming out of the various organizations, and obviously cross pollinating is going to get you to the end result sooner, hopefully.
No, I agree. Some committees, may be more focused on, I'll say, the academic side versus the industry side. And I think it's important, and this is one thing that was very important for everyone working on this to understand, is there's the, I want to say, the theoretical, and then there's a practical application. Right. And I think that having a good balance of both, when people see large documents and it seems like an academic publication, they look at it and go, I can't understand this. But when they see industry and know people have to interpret this, whether they're people in the field that are professionals, or even, I'll just say the person who is just curious on how they should properly handle a disinfectant or something, that's in the workplace, and there may be their employee. It needs to be something that can be easily distilled for those individuals from a practical standpoint.
Good. Well, we really appreciate you coming here today and
Sure.
talking to us.
Thank you. I
Thank
appreciate
very
the
much.
opportunity.
And well, I'll see you at the committee meeting.
Yes, sir. Thank
All
you.
right, thank you.
Take care.
Anyway, we'll continue live coverage from AIHCE 2022 in Nashville, Tennessee. I'm Bob Krell, Healthy Indoors Magazine publisher and founder. Again, joined today with my co-host for the Indoor Environment Show, Don Weeks, who's the president of IEQGA, the Indoor Environmental Quality Global Alliance.
Thank you.